Sea Diving Physiology, you know already that. What's the importance of this? Why we need the sea diving? কোথায় কোথায় লাগতে পারে sea diving? Anyone? Anyone or two? Any ideas? That's why we have to understand the physiology behind this. কোথায়? একটা হচ্ছে recreation, একটা হচ্ছে recreation, scuba diving করিস তো তোরা, অনেকেই করিস, ঠিক আছে? That is important. Another, military service. Military জলের মধ্যে দিয়ে যাবে, হ্যাঁ বল? Submarine, yes. Then again, any other? Marine submarine हो गया. Then constructions of cable, internet cables all throughout the in the below our sea. Internet cables are constructed in the level. এই যে আমাদের ইয়েতে হয়েছে না, হাওড়ার তলা দিয়ে যাচ্ছে জল, জলে কি করছে কাজ? না এমনি চলে যাচ্ছে? No, not like that. So that is important. That lying like the sea, that's also in case of liver also. That means what? What is happening is that if this is our sea level, in this right now, whenever we are rising up, that means it goes to the hill, the atmospheric pressure will fall. So the partial pressure of oxygen, carbon dioxide, nitrogen will fall. Now when you are diving that, your partial pressure will increase. Concept ta etai, ar kichu nei. So if it is increased, that means what? Some distance are there. If it is increased by the 10 meter, every 10 meter, 1 atmosphere will be added. So it is 1 added, and then again 1 is there, so plus 1. That's why it is. বোঝা গেল? Similarly, if it is some key, then see. So whenever you are dying down this, every 10 meter, in every 10 meter descent will be added by 1 atmospheric pressure. 10 meter means what feet? 33 feet. 10 meter means around 33 feet. 20 meter means 66 feet. So that is was 4 atmospheric pressure. So what is increasing here? Increasing the atmospheric pressure is increasing, right? Now, when they are driving with the gases, mixture of gases like oxygen, nitrogen, all are there. In the atmospheric air, it is 78% of nitrogen, 21% is oxygen, and that is termed as FiO2, right? That is 21. Huh? You know that FiO2, fraction of inspiratory oxygen, that is 21. That is present, but when we descend that, pressure is highly increasing. What pressure? Partial pressure. Now you know that the Boyle's law. কি বলা আছে Boyle's law তে? P1 V1 equal to P2 V2. বা এইভাবে বলা যায় যে P is directly inversely proportional to the volume. P is inversely proportional to the volume. Now pressure has been increased, and then volume should be decreased. That means compression of gases. That means what? Compression of the gases. তাহলে যদি এইখানে যদি আমার 1 লিটার থাকে, তাহলে এইখানেতে তার থাকবে হাফ লিটার, বোঝা গেল? ভলিউমটা কম্প্রেস হয়ে যাচ্ছে। এইখানে আরো কম, 1/4 liter. So volume is decreasing. That means volume is compressed. Amount is same, but volume of gases is compressed. Now, Another theory is that, another law is that when partial pressure of gases of any is increased, then the solubility of that gas is also increased, right? Now, suppose you have descended up to these 100 feet. You or any workers or any military has ascent, have descend into the 30-meter distance. Now, what should be the partial pressure of oxygen inside his alveoli? Any idea about that? Normal is 104. Any idea? তাহলে partial pressure of oxygen এখানে বাড়বে তো? Partial pressure of oxygen এখানে বাড়বে। কারণ কি আমার total atmospheric pressure বাড়ছে, that means partial pressure is increasing. So you can't imagine that. That is 3004 millimeter Hg. That is 3004 millimeter Hg beyond imagination. 104 থেকে ওইখানে যেতে পারছে। So that may cause the increasing the solubility of the oxygen into the blood. What is the changing? What you are going to the problem in our physical body? Because of the increased solubility of the gases or mixture of the gases. Gases means normally what? Oxygen, nitrogen, carbon dioxide. Right? Now oxygen, first of all, you are doing to the partial pressure of oxygen has been increased. So the solubility have been increased, and so the solubility and increase means what? In every tissue in the blood or in the blood and cells, oxygen has been reached in high amount. Then what will be the problem? Very well. দেখি হ্যাঁ বল হ্যাঁ কি বলছি বুঝতে পারছি না রেসপিরেটরি ইনক্রিজ অবশ্যই হবে বাট why and why it is happening so এই যে ভলিউমটা তখন কি হচ্ছে ভলিউম is increasing so expanding and that is come as a bubble and nitrogen bubble is more dangerous because sometimes it may occur in every tissue even skin and that penetration is very rash and not only that you can pop it এগুলো ফাটাতে পারবি তুমি বোঝা যাচ্ছে so nitrogen bubbles can go anywhere any cerebral kidney heart in case of coronary circulation it will cause myocardial infarctions right in case of these strokes so that is dangerous so whenever we are any subject is inside the sea for a long time having the nitrogen gases etc then you have to check whether he or she will come in stage by stage. Number one. Number two, if it happens in the sea level, then there is a recompression chamber is there. At which pressure the subject was inside the sea, say pressure oke abar rekhe deya hobe. Then it will release decompression slowly, so that the nitrogen bubbles does not affect the other areas of our organs. So that it can eliminate it from the lungs very slowly. That will be clear. So problem is that quick ascent. So whenever ask any questions of dysbarism, chokes, bends, decompression sickness, even Casson's disease, is all are due to the rapid ascent from the sea level up to the sea level. That is below the sea level from the sea to the inside the sea to the sea level. Rapid ascent. Prevention is the staging, stage by stage ascending, as well as recompression chamber at the sea level. বোঝা গেল? এটাই হচ্ছে main জিনিস for the sea diving, etc., etc. Now scuba diving also says that. Now scuba is come as a short note. What is the full form of scuba? Anyone? Anyone? Scuba. SCUBA. Anyone? Full form? Do you know the full form? Yes. It is a self-contained underwater breathing apparatus. It's called self-contained underwater breathing apparatus. That is scuba. Scuba diving, all are fond of this one. And scuba diving is two types. There is open circuit and closed circuit. I am not going details at all. We are most of the cases of open circuit we prefer because closed circuit is for the military operations, because military operation does not want any sound in the inside the sea of the bubble also. The oxygen is chharchita je awasta setao jate in enemy jate na pai. That's why they are using the closed circuit scuba, right? That should be trained, and there is a mixture of gases are taken, and there is a well trained training chhara scuba diving korte gele ja hoy already you know. This scuba kintu is not so easy. Okay, so that's the total chapter of the sea diving. And always, whenever you are reading the sea diving, always try now. So try always to compare with the hill station changes and below the sea changes. Then only you can remember. Right? Both the questions are important. Acclimatizations, already I told you everything. There is why polycythemia happens, hyperventilation happens, hyperventilation followed by hypoventilation happens, all our neural control happens, central chemoreceptors activity is there. Similarly, in this patient, you have to understand oxygen toxicity, nitrogen toxicity. Now you can say, what about the carbon dioxide? Yes, carbon dioxide has a brain, but carbon dioxide water is forming in our body is very limited. So the partial pressure of carbon dioxide changes not much more. So the solubility does not much more. But if it is the partial pressure of carbon dioxide is more than 80 millimeter of Hg, normal is 40. If it is 80, then that will create a central nervous system depression. Right? That is an important point, you can say. But nevertheless, our carbon dioxide does not create any problem. Problem is our nitrogen mostly, and then oxygen. Most of the cases is nitrogen narcosis. And nitrogen narcosis when you are descending. And chokes, bends, dysbarism when the patient having nitrogen narcosis or solubility or enter into your body or different tissue, nitrogen chupchap bose ache. Now you are ascent quickly, then that gas will expand and forming the bubbles. These bubbles will escape throughout the different capillaries. Right? Even skin, even each organs, each tissues, huge amount of bubbles can be there. But if we ascend very slowly, the bubbles will not block the arteries or any capillaries or going the symptoms. The staging ascent, that is called staging ascent. If already patient has been ascent and problem is there, then we can use the recompression chamber. How? Because we have put the person into that pressure from where he or she ascends. যে প্রেসার থেকে এসেছে সেই প্রেসার ওকে আবার রেখে দেবো কেন তার কি হবে বাবলস ফর্ম করবে না রাইট সো বাবলস ফর্ম না করলে বাকিগুলো হবে না নাও ইউ decompression slowly so that the nitrogen bubbles or nitrogen is coming out from the blood that we eliminated through the lungs slowly আমার নাক দিয়ে বেরিয়ে right. So that is called recompression chamber. Ascent chamber যেটা করা হয় সেটা হচ্ছে হাই অ্যাটমসফিয়ার প্রেসারে রাখা হয় so that water cannot enter. বুঝা যাচ্ছে? So that water cannot enter, so that they can walk properly. But their ascent should not be quick. Their ascent should be staging. And that happens. That is done periodically. That is a chart. The patient or subject having in the 90-meter distance, then how the staging will be there, there is a chart. If any subject is having suppose 100 and 120, that will be having a chart. Now this nitrogen narcosis will be totally come as a death, that is your beyond 200 and 250 feet. সেখানে কিছু থাকবে না, clueless. তার আগে মেন প্রবলেম শুরু হয় basically 100 to 150 feet. That problems like the juvenile stage 1, euphoria, then it will cause as a drowsy, just similar to the alcohol intoxications. And that's why it is also called Martini's law. এটাকে কি বলা হয়? Martini's law. Do you know the Martini? Martini's law. So 10 meter down cause one Martini. So that's why the Martini's laws is also another term for during your descent and your narcosis. Not only that, you know the barometric pressure is changes, so your sinuses, your ear, your middle ear, pressure changes will be there. Conjunctival hemorrhage will be there, right? So that is a very minor symptom due to the barometric pressure high. Your sinuses are pressure is there, so that will changes. Congestion of the lungs, and also it can happen is a perforation of the tympanic your membrane. That is also a part. So that's why another term of the descent or nitrogen narcosis is a rupture of dip. Another call is called rupture of dip. So all are same. All are same. So those are terms are there. Don't confuse. I hope the Martini's laws and rupture of dip will not give in your first year professional MBBS. But the another, whenever you are ascending up quickly, dysbarism, chokes, bends, and decompression sickness, gaseous disease may come in your exam. Right? So it's very clear concept in very short, in very lucid manner. You have to understand and go to the after the completion of all the classes. You please write down the what I have told in this class. Just write down. যে স্যার এইগুলো আমাদের বলেছে, এরকম একটা চার্ট আঁকা হয়েছিল, নাইট্রোজেন নার্কোসিস বলা হয়েছে আর নাইট্রোজেন বাবল বলা হয়েছে। নাইট্রোজেন নার্কোসিস ডিউরিং দ্য ডিসেন্ট and nitrogen bubble and chokes, bends, etc. are during the quick ascent. Clear?